cancer and chemo just take over your whole life.
Coming up today, she turned 36 and the very next day started cancer treatments. Months later, her mom started her own cancer treatment. Meet Terry and Lindsay, mother and daughter fighting different cancers at the same time. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Terry and her daughter, Lindsay, are joining us here in studio with us today, along with Dr. Priyanka Sharma, breast medical oncologist and researcher who helped Terry through her cancer journey. We're going to hear how Terry and Lindsay endured simultaneous cancer journeys. But first, let's get to our morning rounds today. We are going live to Dr. Ronald Chin, Chair of Radiation Oncology at the University of Kansas Cancer Center. He and several members of his team, they are in Washington, D.C. right now for the annual meeting of ASTRO, the American Society for Radiation Oncology. Dr. Chen, good morning. Good to see you.
Hey there, Jessica. Good to see you.
Good to see you. Okay, so what is ASTRO and why is it important for providers like you and your team to be there?
Well, ASTRO is the biggest radiation oncology conference in the world. Once a year, radiation oncologists from all around the world get together at this conference to learn about the latest advances in radiation oncology and cancer treatment. So this is where some of the cutting-edge research and results are being presented. And there are over 10,000 people attending the ASTRO conference every year.
Dr. Chen, I hear you saying that smart people are just sharing a lot of smart ideas.
I guess that's true.
That's very true. And you're one of them. The University of Kansas Cancer Center has a pretty big presence at this year's conference. How many people are involved?
Yeah, we do. We have more than 20 people from our department here at this conference. We have physicians here, but also we have medical physicists, residents, research staff, and administrators. And of course, as an NCI designated comprehensive cancer center, the University of Kansas is very active in research, and this year we have at least 12 presentations at ASTRO. We're here sharing results of our research in head and neck cancer, prostate cancer, looking at the needs of cancer survivors, grid therapy, which is a newer way to give radiation treatment that seems very promising, and also sharing our experiences regarding our proton therapy program.
And Dr. Chen, you're an expert in prostate cancer. Can you share something new that's happening in that area?
Yes. In fact, there's some very exciting things here. As many people know, a lot of men who have prostate cancer choose radiation therapy for their treatment, and radiation is very effective at curing prostate cancer. But one of the questions that patients often ask is, well, if I have radiation for my prostate cancer, and if the cancer comes back, are there other treatment options? And in fact, the answer is yes. One of the biggest presentations at this year's ASTRO conference was to highlight the 6 treatment options that are available if the cancer happens to come back. So it's really great and certainly reassuring for our patients to know that for prostate cancer, they could choose radiation, which is very effective. But if the cancer comes back, there are many, many options for more treatment if that does happen. Another very exciting presentation this year was about the use of radiation for kidney cancer. Many patients who have kidney cancer undergo surgery, which is a great treatment option. But now there's also a non-surgical option using radiation, which research is showing to be very, very effective and also very safe.
Ultimately, Dr. Chen, you wouldn't be there if this didn't have a grand impact on patients. Overall, why does this conference matter to the patient?
This matters to patients because cancer treatment is always changing, always getting better. And for cancer patients, it's important to know that your doctors are staying on top of the latest treatment advances so that you can have the best outcome possible. Even better, if your doctor is actually doing the cutting edge research and clinical trials so that you could be getting the best treatment before it becomes available widely, like the types of research we do here at the KU Cancer Center for our patients.
Dr. Chen, always great to see you. Thank you.
Thank you. Good morning.
Well, one cancer journey, as you can imagine, is hard enough. Terry watched her daughter struggle with cancer treatments. Now they are leaning on each other and their doctors as they chart a path to survivorship.
I'm always liking that shake it off.
Mother and daughter duo, Terry and Lindsay Durgan, are tight-knit.
I literally celebrated my 36th birthday at the Topeka Zoo with my parents.
But they never imagined they'd bond over this.
And the very next day, I started cancer treatment.
Lindsay, at just 36, got a call from her doctor.
And she was just like, "Are you guys sitting down?" I'm like, "Oh, this is not good."
It was cervical cancer. The news hit Terry hard.
It's kind of like having your legs cut right off. I mean, it was just devastating. I mean, it was just like, I cannot believe this.
Lindsay received pelvic radiation, chemotherapy, and brachytherapy here at the University of Kansas Cancer Center. But despite her treatment, her cancer still metastasized, spreading to her uterus and liver.
"Okay, how long do I have to live?" She's like, "No. We're going to do some palliative care."
Now she comes to the cancer center every 3 weeks to get maintenance chemo treatment.
Focus on the fight, not the schedule.
Made tolerable, though, by her chemo buddy.
Chemo buddies.
Chemo buddies. Cancer club. My mom's got this really positive attitude, like everything's gonna be okay. And she'd been helping me through my journey, like when your skin is peeling or when your nails are falling off or when your hair's falling out. Totally normal. It's totally okay.
She's able to help because she's been there. After Lindsay was diagnosed with cervical cancer, Terry was diagnosed with breast cancer a second time.
It's been stage 4 since it was found in the lung and the bones and the liver.
She was originally diagnosed 12 years ago.
I had to go to a double mastectomy and a lot of chemo and the radiation.
Both Lindsay and Terry's cancer is stage 4. But amidst the chemo and other treatments, they tackle the hard diagnosis with their own special brand of family medicine.
We've always been a very funny, humorous family, and laughter really is the best medicine, because if I wasn't laughing, I'd be crying.
While the cancer may run in the family, so does the will to fight on.
So we just try to make the best of whatever
Humor.
we can. I just feel completely blessed.
It's hard to have a bad day, isn't it? Her attitude is...
It really is, yes.
You don't have a choice. You got to be happy.
No, got to put that smile on her. She's just going to keep coming up. Yeah.
Well, it was a joy to sit down with both of you, because both living with metastatic cancer. But Lindsay, you were diagnosed after an abnormal pap smear, but that's something that you had before, right?
Like my whole life since I started having them, like getting them when I was like 13, 14.
So what made this one different?
It wasn't different to me. It was just, again, annoying having to go through it. It was my primary care doctor that was doing the pap smear that was like, just kept shaking his head. And he's like, just something's not right, And he's like, so we can do 2 options. He's like, I can take some biopsies now while you're here. He's like, or we could wait 6 months and do the pap smear again and see what the results are. And I'm just looking at my mom, and then I looked at him and I was like, okay, what do you think as my doctor? And he was like, I just feel like there's something not right. He's like, and I just want to get this sent off to pathology, and if you need to go see like a surgeon or something, I want to get it done now. And I was like, okay. So then my mom's in there with me and she's holding my hand. I'm like, oh my God, why do I have to keep doing this? But yeah.
So it comes back, and you have cancer. What was that like for you?
I didn't know for like at least a month or so, because they were, I was having all these like different procedures and diagnostics, and by the time I guess it was going to be for someone to call me and say, hey, you have cancer, or now we're going to send you to KU Med. We were leaving for a trip from Maine, so like the day before I was at work, and I got a phone call from a secretary, like not even about my diagnosis, just about the paperwork and referrals. And I was like, I'm sorry, I'm leaving for Maine tomorrow with my family. What are the referrals for? And she's like, oh, honey, has no one told you? I was like, told me what? She's like, honey, you have cancer. We're referring you to an oncologist. And I was like, I'm sorry, what? What? She's like, seriously, nobody told you? I was like, that's sort of, I don't know. I don't think so, because that's
kind of a blur in some aspects.
Yeah, it was a shock.
A shock.
She's just like, okay, well, good luck and have a nice trip. I'm like, yeah.
So
It's bad.
I want to talk about this because when we met, you were going through your maintenance chemo, and you're doing this every 3 weeks now.
Yes.
We heard a little bit in the story just about how it came and it ended up spreading. So now you're on maintenance chemo. How has that been going for you?
My whole life revolves around it, and it's been going well. I've actually responded really well to the treatment. When I first started chemotherapy, it was like the week before the drug Keytruda. It's like an immunotherapy drug. Dr. Plunicki, my oncologist, had been working on that drug, like trying to get it approved, and literally the week before I started treatment, it was approved, and he was so happy. He's like, well, we're gonna add that on, and I really think that's helped make the difference too, just because it, helped me feel stronger, and it gave my body the ability to recognize, the bad cancer cells, and I don't know, it gave me like an extra oomph to fight back. But yeah, it was a lot. Those were some really long 12-hour days.
Yeah. Terry, what's your treatment like today?
Well, when I started my treatment, it was with Dr. Sharma and her team. They've been fabulous. And I started with Verzenio and Femira. So it was a combination that actually was pills. And I think that's not something that people might realize. So I took the medication for, I think, about close to 2 years before we discovered that part wasn't working, and something new I learned is cancer will work around things. And so
It's tricky.
Dr. Sharma has been working with me on different types of treatments, and right now it's chemo and Keytruda. And that's what we're working on to see if another several weeks where things are at in the scans.
So you were by Lindsay's side when she struggled with the side effects of chemo. How have you both been supporting each other through this?
Oftentimes when Lindsay has her own house, but she's been staying with us, especially through a lot of the harder parts of the treatment, or when things are hitting her a little harder, or she's in a hyperbaric chamber treatment. We needed to take her daily for that. So I think it's been a support just being around each other, and one of us can be up even if the other one's a little bit maybe not feeling as well. And then my husband, Bob, her dad, he'll come in and ask us, what kind of food or what are you interested in today? And he'll try to make that for us. We'll find something really good to watch together on TV, like comedians. It's a giggle.
Yes.
Going out in the garden and doing some gardening. So where you lift each other up. And Emily, her sister, is in Seattle, and she would fly back and try to help us with a lot of logistics of getting ready.
And I think we have some photos of Bob and Emily and your support system. And Bob is here with us this morning too, over in the wings, taking care of his girls, because it's really been a family affair, right?
It really has, and also friends. We have a lot of friends that, for us, especially taking pain medication, driving from Lawrence, we have quite a team.
Quite a
of people.
network of people.
My husband's Bible study.
They
friends
drive
of
you back
mine,
and
they
forth?
drive back and forth. Good
Yeah, as
friends
early
of
as
ours.
6 a.m. they'll pick us up, and they're just as chipper as she is, and I'm in the back seat like, no more.
Not quite the morning person.
Not
I take
anymore,
it.
no.
But you need that. You need that shot of positivity. Dr. Sharma, I want to bring you in. Good morning.
Good morning.
Good morning. So you treat only Terry, but explain for those watching what maintenance chemo is and those after effect maintenance, what that is like for a patient.
So it can have different meanings. I suspect what currently is occurring is maintenance with immunotherapy, which is quite common. So many cancers are treated with combination of chemotherapy and immunotherapy. And once we get to a desired level of response, that may or may not be a complete response, but a good enough response where the cancer itself isn't causing any organ damage issues or major symptoms, then the chemotherapy can be scaled back and immunotherapy can be continued. Immunotherapy by itself has very low level of side effects, at least on a day-to-day basis. It doesn't impact blood counts, ability to fight infections, hair. So from all of those perspectives, it's a pretty well managed treatment for patients with cancer. And right now, immunotherapy is available and approved for many different types of cancers.
Well, when you hear a stage 4 diagnosis, it just sounds bleak, Dr. Sharma. But in today's terms, with what we know and how advanced we are, what does that actually mean?
So, when we say stage 4, that means the cancer is outside of the organ that it started in, and, depending on the organ where it was. And typically, historically, what that has meant is treatments are available, but getting to cure where one can get rid of the cancer completely and not need any more treatment is not going to be a likely possibility. For many, many cancers now, we have such better treatments than we did, let's say, a decade and a half or 2 decades ago, where the treatments will induce a response, shrink the cancer, and some of them can be taken for long periods of time without what we call cumulative toxicity. So chemotherapy works well, but one can't stay on any chemotherapy pretty much for a very, very long period of time because they all have toxicity or side effects that build up that prohibit us from continuing to deliver these drugs at good dose levels. But drugs like immunotherapy, many, many targeted drugs don't have that issue of cumulative toxicity. So one can continue taking it as long as the medications are working to control the cancer and the body's tolerating them. And we see 2 great examples here where, in spite of stage 4 breast cancer, the available drugs or treatments have provided control of the disease, balancing the quality of life for prolonged periods of time.
Dr. Sharma, is there a hereditary factor to both mom and daughter having cancer?
There can be. There are mutations that are associated with, breast and ovarian cancer, breast, colon, and other types of cancers. Cervical and breast are less likely to be related genetic-wise, at least the way we can test for mutations in an individual. Of course, environmental factors, which are less studied and much, much harder to study, can play a role when you see a cluster of cancers in families because one can assume that they were exposed to the same environment.
Lindsay, I want to take a look at
even in the absence of genetic mutations. Yeah,
that makes sense.
Yeah.
Lindsay, I want to take a look at some interesting treatments that you have been undergoing. That includes some time in a hyperbaric chamber, where this is where air pressure is super high. Your lungs can get more oxygen than usual. Why were you getting this treatment?
I had some very high levels of radiation done the first 1.5 years of my cancer journey, and it caused a lot of problems with the fluid buildup, lymphedema, and a heck of a lot of, neurological, like neuropathy in my hands and feet, just, the nerves. And so basically my skin was so stretched, like I could barely be touched, and laying down was awful. So they were thinking, okay, well, we have all these ideas, but let's try this hyperbaric treatment because it oxygenates your whole body, your organs, and everything, and kind of just like promotes more healing. And so I did it for 40 days. Yeah, 40 days, like Monday through Friday.
What was it like inside there? Because you're like in a cylinder.
Yeah, it was nice. I'm claustrophobic, so it was a concern, but I could actually sit up in it, and I sometimes would be, dancing to music. I'm blind as a bat without my glasses, and I've got anxiety, so I had a lot of choices, and I was like, I'm just gonna go in there with my glasses, and I'm gonna listen to music. And of course, I was always picking Taylor Swift, so of course, when you're in there for like 1.5 hours almost, and the nurses out there like, watching all the levels and everything and checking, making sure you're okay. But for the most part, I was just in there singing songs and according to them dancing, and I mean,
You were embracing the treatment.
Oh, I was trying to have a really good time because I was trying to forget that I was in a glass ball.
Yeah, what else are you going to do than bust a move out and Taylor Swift?
If I had an emergency, it was going to take at least 20 minutes for the levels to go down before she could even get me out. So
you spent time in a compression suit also. This was for lymphedema.
Yep.
Right? What was this like? What did this feel like?
It's like being kind of like squeezed like a towel. It just basically it's moving your like all the fluid through your lymphatic system towards your bladder so that you'll, urinate it out.
Like squeezing it down.
Yeah, just like I don't know, squeezing a tube and
toothpaste tube.
Yeah, so it's just constantly like there's just different parts of your body, like it just like a different, I guess movement where they move it around. And, I've gained 50 pounds in the last 3 years, just mostly of fluid. So, it's impossible for me to walk or move or really do anything comfortably. So it was nice when I can get the suit to fit. Even with all that Velcro, sometimes it's a little hard, but it works really well.
I'd never heard of lymphatic taping before. How does this treatment help? Really interesting.
So yeah, that's Gabby. She was so amazing. I worked with her for about a year, and I mean, she got me walking, and she was able to touch my skin. But basically, the tape it follows all those like lymphatic, like
Watershed.
yeah, like the way the way the fluid moves about your body. So all the tape took forever, follows that, and then she can like pull your skin in certain directions. That also kind of redirects the flow. The point is to get it moving so that I can pee it out, because the less fluid on me, it's better for like my heart, my legs, my morality.
Okay, be sure to ask your questions. No questions off limits with these two. Anything about cancer, living well with cancer, you can ask it. Use the links on your screen. You can email the Medical News Network. Information is right there. Terry and Lindsay, of course, you called yourself chemo buddies. You have your little fist bump, and yes, and that makes everything kind of spark into this new realm where you guys really are there for each other, and I could really sense that. Lindsay, do you remember your mom undergoing her first cancer therapies way back in 2012? What was that like for you, younger, watching mom go through this?
I remember the day they came home, her and my dad, and it was just very serious, and I was like, oh, this is definitely not good. And they're like telling me, like, she has cancer. I'm like, what does that mean? And she's like, oh, well, I'm gonna have to have treatment. I'm like, I know, what does that mean? It was like, I was trying not to say, are you gonna die? Because that was the first thought I had, was like, oh my gosh, I'm gonna lose my mom. And it took me a few days to like stop the tearing, and like it was stage 2, and they said that there was a lot of options for her, and of course her big smile on her face, and I'm gonna do this, and still teaching 30 students. So I mean, it was just amazing, like the things that she was capable of doing, and no matter how tired the treatments made her, she was always ready for more. And I'm not even in cancer treatment at that time, and I was like, I'm exhausted, and she's still like, I'm gonna run circles around you. There's just something about my mom. She has this spirit.
She's kind of magical. I'm guessing that's kind of what I'm getting from her.
I always tell people, nicest woman on the planet. But I mean, she will go mama bear for her daughters. It's just not the, like the rawr kind of mama bear. It's just, she uses that really sweet, kind, just really surprises a lot of people.
Dr. Sharma, you've gotten to know Terry. Terry had a double mastectomy years ago. How then did the breast cancer come back again or spread?
So, cancer cells, even after surgery and initial therapy, which Terry had chemo and also anti-estrogen therapy, can stay dormant in the body. And some of them may not have gotten killed with the initial therapy. And at some point in time, some of them decide they're going to settle in other parts of the body. And that's how it shows up as what we call metastatic or stage 4 disease, or quote, came back. Sometimes it's just back in the local areas, right? Like if it started in the breast, it's just back in the breast or the armpit area. Other times it is back in organs outside of the breast and the armpit area. It's still breast cancer. If it comes back and we see spots in the lung or the liver or the bone, it doesn't become lung cancer or liver cancer or bone cancer. It's still breast cancer cells that are in those other parts of the body.
Terry, you mentioned.
And, the research is constantly working on improving the initial treatment, right? So that we can cure more patients up front, so that we have less patients where the cancer has come back in a metastatic form.
And that's what we like to hear. Terry,
yes.
You had mentioned this circle of friends. Tell us a little bit more about them and why that's so important for you and for anybody going through something like this. Your
think-
happy place. Tell us about your happy place too.
Oh man, I have a lot of happy places, but you know, the people that are with you that mean the most to you, I think it's so important to have them around when you have either a cancer diagnosis like or stage 4, even though people wonder, I think, and it's important to be open that I even asked Dr. Sharma at one point, do we need to consider a hospice treatment? Oh, no. We have lots of options, but I think that's something that is important to have the people around you, because once they kind of understand that, they can also be part of your support system to lift you up and do things, and they understand there's days that or times maybe are a lesser energies, as we've been working with our counselors who are also part of the KU Cancer Center, that there may be days of low energy, medium energy, or high energy, and understanding that and then letting others know. So I think that circle of friends and the people around us are family, and I'm a big auntie with lots of nieces and nephew and some great nephews, that it's so important to hear their voices, and it just makes your day. And those memories are really important, I think, to make that you don't feel like I have to make them because we're rushing to a finish line, but just stop and enjoy the present.
Lindsay, I want to share some photos of your care team. They weren't able to be here with us today, but what have they meant to you, and how important have they been through this ride?
They are. We always have a good time. I'm a pretty fun time. Like I like to make people laugh even when I feel terrible, and I learned that from my dad. He had a lot of heart issues a lot of his adult life, so he's always cracking jokes, even though if he said his some serious surgery. So I always try to lead with that, and sometimes it's like the first day is a little awkward, and we're all just kind of tiptoeing and getting to know each other, and then the second day I get in there, I think the second time I saw them, they were like, okay, this girl's just really sarcastic and funny, so what she's saying isn't really serious, she's joking. And now that here we are 3 years later, and we've got running jokes, and I mean, Dr. Plunicki is a riot. He's just so funny, and he's got great staff, and I got really lucky that I found a really great team. Dr. Plunicki, Dr. Hoover.
I do want to mention another part of the team has been, you both have sought out mental health services while dealing with it. I want you to talk about how important that has been, just really encouraging people to make sure that they're always taking care of their mind, their mental health during this time.
I think it's really important because you can kind of get into your head, even the first time I was worried about, and there's nothing you can really do about it, but I was worried about not being as participatory with Lindsay and Emily, or not making it to see them into adulthood. And this time around, they're the adults and and they have their own different feelings about all of this too. And I think it helps me to perhaps go through with somebody like a counselor that can give some other ideas of how to work at something, keep things in the present when something comes up that may be a little bit more concerning, feel it and move it aside so that you can actually work at the living part of your day as well. She can't ignore all the things, and I may be really positive, but that's what I lead with. But you can't help but have some things creep in. Dr. Sharma has been very important part of it, because she'll refer out, as Lindsay's doctors have, for whatever is needed. There's a huge team here at KU Medical Center that I don't know that even as a person growing up in Lawrence as a townie, that I even knew that now that the designation, the cancer designation, there's so much here.
I'm glad you're using all of it. Some people just want to go to one spot, and you're reaching out to all of the areas that matter. So.
And I was in a trial with Dr. Sharma for a bit too, because there could be a doctor's choice or the what she suggested that I try. And the nice part is, I don't think people realize with trials, it's not that one's hidden and you don't know if you're going to get the treatment or not. This was the doctor chose, or there was the treatment. And I really appreciate that. And she was a key researcher on that trial.
Well, we want to remind everyone as we're talking about cervical cancer today that it could be eliminated one day thanks to the HPV vaccine, but HPV vaccination rates have been very low. So please, if you have children, especially preteens, talk to their doctor about the HPV vaccine. It could possibly down the road save them from a cancer diagnosis. So just want to always put that reminder out there. We want to get to some questions from our viewers. Some questions, but really some comments as well. Also, Kathy says, thank you for this episode. Several friends going through breast cancer right now. My sweet sister-in-law just had a double mastectomy, has triple negative breast cancer. Can you give a brief explanation of this type? Dr. Sharma, explain triple negative breast cancer.
So triple negative breast cancer is one of the types of breast cancer. It's about 20% of all breast cancers. And typically how we define is that the cancer cells lack hormone receptors, which is estrogen and progesterone and another protein called HER2 or HER2. So being negative for all these three make it triple negative breast cancer. The common way to treat this breast cancer is with chemotherapy and immunotherapy in early stage setting. And of course, surgery and radiation are part of treating early stage breast cancer.
Yen Liang says, thank you for today's guests for being so willing to share their stories. Cancer treatment in this process never easy. The question is, should other family members also be cautious about the risks of cancers like colon cancer or ovarian cancer? Should these risks be taken into account? And would it even be advisable to undergo genetic testing? Dr. Sharma.
I think genetic testing is part of our standard cancer care for many cancers now. And if a mutation or a genetic change is found, then what we call cascade testing and letting the first, second, and third degree family members know about that mutation in the family and let them choose about testing and surveillance is quite important. But in absence of a genetic mutation, one should stick with standard guideline screening, like we talked about, pap smear for cervical cancer, colonoscopies. Now, the recommended age has moved up from 50 to 45, and other cancer screenings based on age and family risk. But typically, cervical cancer and ovarian cancer don't have a genetic link that we know of yet.
Jeremy says, first off, you two are amazing. Sometimes in a crisis, it can either pull people together or push them apart or isolate them. Knowing what your relationship, love, and teamwork has done to help you both through this, what advice would you give to somebody maybe going through this alone?
You need support, whether it's, like your doctors or like even a therapist. Like I have a therapist that she exclusively works with cancer patients. So like when my journey started, I literally lost, I turned 36. I lost my full-time job I'd had for 6 years. I moved in with my parents and, I was basically sleeping like a sloth for 1.5 years. And I mean, I lost everything and I didn't even have enough time to process it. And I had a counselor that was working with me through it the whole time. So then when I had some time to think about it, it was incredible the amount of grief and anger I had about the whole situation. But as I say to my parents a lot, you can't do this alone. I mean, just the amount of times we have to drive up here, it's just like having someone able to drive you and, someone to just hold your hand, someone to just, come and veg out the TV with you, just anybody. And I know a lot of people, they don't know what to say, they don't know what to do. And I just say you can say, I'm so sorry. But you don't have to be sorry. Like, I'd rather people is there anything I can do for you? And I'd be like, well, you could tell me what's the best show on and come watch it with me, or just call me once a week and
let's binge something together.
Yeah, or just see if I'm still breathing. And
well, Lindsay, your point though is that you're never alone, as they say, but
Yeah.
It's true. When you think you're doing something alone, there's people out there who really want to help. You just have to really know where to look and where to go. People really, I think, want to help.
Oh yeah, they do.
Can.
And they always say to each other and to other people I want to do something for them. I just don't know what to do. And so we've reached out and just been like, what we need right now are rides. And then at the beginning it was we need help with making meals because we were just going in so many different directions and it's just so hard to keep track of it all. And I know there's support groups like there's the Turning Point here, and I know I've also seen a lot of specific support groups for specific types of cancer, and I know within those you know, the group will come together. So yes, they might be strangers like for the first little bit and it's a little awkward, but you're all going through the same fight and you're all dealing with almost the exact same feelings and trials, and it's so much easier just to have one person, you know, keeping track of you.
Marcia says you both are so lovely. Thank you for sharing your stories and your insights as a result of your journeys. Can you share any thoughts with others who have been through cancer treatment and are coping with the fear of recurrence? Terry?
I think I would say that was where I was at in 2012, is that even though we were doing the double mastectomy and radiation and chemo, and even coming out of that, I had that fear. I think probably all the rest of the time, even enjoying life and getting back to it, it kind of moved from here to maybe over here, and then I could get it moved over there. And part of it was trying to focus on my family and friends, as a teacher, the students that I had. So art, because I really enjoy that, so I have an art room that Emily, Lindsay, and Bob wanted me to have, and we redid the little part, and that was helpful.
I own a little studio in our house now.
Yes, I think some of those things is also maybe giving yourself permission to engage in some different ways of, instead of, I think I always wanted to do certain things, and it's like, well, maybe there's certain things that we should do now versus certain things that I should thinking about waiting for. So I think
Finding that balance, and
that kind
Yeah.
of takes that fear away, because you're focusing on living and doing things. Even with the stage 4, it moved back right here in front, and working with Dr. Sharma's team and everyone that's helped, it's moving further back, so it's not something that's just right in front all the time, and that's helpful.
Dr. Sharma, what's the big takeaway from listening to Terry and Lindsay this morning? What do you want people to walk away with?
That it takes a team and a village, right, to treat cancer, and we're just not treating cancer in isolation. We're treating the individual that has the cancer, and the talk about soliciting help for mental health, soliciting other types of supporting measures to take care of life-altering side effects like lymphedema and other things are as important, if not more important, than the actual treatment itself. Of course, we have advances in treatment of cancer, and then simultaneously we also have advances in helping manage side effects, helping create more supportive care to improve quality of life for patients who are survivors of cancer. So it does take a large team and a village. And we're very happy to have that at KU with our NCI Comprehensive Designated Cancer Center.
Thank you so much for being with us today. We appreciate it. Terry, what's the big takeaway from your story?
I think the big takeaway is, well, a couple of things. For women's health, continue and make sure you're getting your checks, because sometimes it's easy to get busy and you don't realize maybe a little bit of time has gone through. So the Pap smear Lindsay's had saved her life. The mammogram I had, at the time I had it, they weren't sure, the radiologist thought about whether we should just wait another 6 months or refer then, and he decided to refer then. That was huge, because I was already at a stage 2 when it actually got looked into. And then the other part is just keep living life. You have faith, family, friends, and fun, and just keep enjoying life.
Lindsay, I'm going to let you wrap us up today. What do you want us to take away from this conversation?
Like in the beginning when this first started, I immediately started thinking, like, I've got to tell every woman I know, you have to stay on top of your vaginal health, because I was saying, if I had a husband or kids, or if I had plans for that, this would have totally just shot a big old bomb into that plan. And just, I guess, give yourself a little bit of, grace, like that this is not your fault. This is not something that, like it's not like a disease that someone gave to you, or, it's just.
It's not a choice.
It's not a choice. It happens, and you've got to just take those snowballs as they come, and just, always ask for help, and just, if you think there's something wrong with your body, go to your doctor and get checked. And if they don't give you the satisfying answer that makes you feel better, find someone else. Don't ever, ever stop, because then you get to a stage 4 diagnosis, and there's not a lot of options of it going away or cured. So I will carry this with me for the rest of my life, but you know, I just want other women to not have to do that. So just stay on top of your health, and if one doctor's not listening to you, find someone else. Don't
We
ever
cannot
wait.
thank you enough for both of you being here to share your story and just be such great examples of advocating for health and just being so positive and amazing, as everyone who's watching has been saying. So
Thank you for having us too. I
Yeah,
think
thank
this is
you.
important for women and families and friends to hear.
come back and see us.
Thank you.
Anytime.
Anytime. All right. Thanks so much, ladies. All right. Thanks to our viewers as well for being with us today. Chemo Buddies, little fist bump over there. I love it. All right. We'll see you back here tomorrow. Breast cancer doesn't discriminate, but outcomes often do. Women of color face poorer survival rates, and it's time we ask why. I'm Jessica Lovell on the next Open Mics with Dr. Stites. The factors driving the disparity and a woman who beat the odds. Her story of hope and a call to action. Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.